information with you, and then we will get to a media Q&A portion towards the end of today's meeting. A couple of notes before we get started. We do have a couple of interpretation options. We have a Spanish language interpretation channel and an AS, American Sign Language interpretation channel, if either of those options suit your needs. And we have that gray slider bar available to customize your view a little bit there as far as what you want to see versus the slides and the speakers. So today on our agenda, we have Director Scott Bookman, our COVID-19 incident commander, who will join us for the Q&A portion, Dr. Eric France, Chief Medical Officer, Dr. Rachel Herlihy, State Epidemiologist, and Tavio Parocchi, our Data Manager at CDPHE. We'll start things off with Dr. Herlihy.
Thank you. Good afternoon, everyone. Thank you for being here. So I want to give a quick update on our overall COVID trends here in the state. So starting here with our case trends, you can see that we've continued to see a nice downward trajectory in the number of cases occurring here in Colorado. And I will be showing you some data that compares Colorado to the rest of the country right now, where we are seeing some different trends. If we move to the next slide, here you can see that we're seeing a very similar trend when looking at our percent positivity trend. So again, percent positivity is the percentage of our PCR tests that are being performed in the state that are coming back positive. Our goal is to be below that 5% mark. You'll see that we are getting close to that goal level. We're now at 6.1%. And similar to our case trends, we've seen a steady decrease in percent positivity value over the last few weeks. Next slide. Next, comparing Colorado's case rates to overall US rates right now. So as I described, we continue to see this clear downward trajectory here in Colorado when looking at our cases. But the trend is quite different when looking at the overall US trends. One thing you'll note is that Colorado did see an earlier wave of COVID-19 with a peak around mid-November here in Colorado, while cases continue to go up in the US this year. And then last year, we actually saw a very similar trend where we saw an earlier increase in cases here in Colorado. Our cases started to decline as we were starting to see the US cases peaking. So again, this points to some element of seasonality perhaps, and I think lots of unknowns still to come with Omicron and what that might mean for both US trends and Colorado trends over the next couple of weeks. Next slide, please. So this is very similar data, but showing you hospitalization rates here in Colorado compared to the US. One important thing to know about hospitalization data is that it does lag quite a bit behind US data, especially when we're looking at the US statistics and the rates of hospitalization across the country. So these data, though they were just updated, are actually data from early December. And so one of the things you'll notice here is that Colorado's hospitalization rates have started to decline, but have not declined as far as we might expect them to, again, because this data is a little bit lagged. But you can see that clear pattern where Colorado's hospitalization rates are now going down, where we see this clear increasing trend for US hospitalization rates. Next slide, please. Just a quick update on Omicron. So there has been some new data that has come out. Much of the data is still early data, preliminary data, but we are learning a little bit more about the Omicron variant this week. Some of the characteristics that are coming a little bit clearer into focus, characteristics about this particular variant include increased transmissibility. So it does look like the Omicron variant is spreading more easily from person to person, and that is resulting in really steep case increases that are being observed in South Africa and now also some European countries. The UK is seeing a steep increase. Denmark is also seeing a steep increase right now. We also have some early data that suggests reinfection may be more likely to occur with Omicron variants than earlier variants or the ancestral strain of the SARS-CoV-2 virus. It also looks like vaccine breakthrough infections may be more common. But we are seeing higher levels of protection against severe disease when compared to the level of protection against infection. So this is, of course, really important to note that vaccine does appear to continue to be highly effective against preventing severe disease in individuals. And the news is even better when we look at protection with booster doses. So it does look like we see high levels of protection for individuals that have received booster doses against the Omicron variant, both for infection and for severe disease. The data are a little bit more mixed on severity. So there have been some anecdotal reports suggesting decreased severity associated with the Omicron variant in South Africa. The data are really very early at this point, and so it's difficult to make clear conclusions about severity overall. But there was a new report that came out of South Africa just this week that did suggest that there is perhaps some decreased level of severity. They estimated around 30% decrease in severity associated with hospitalizations among adults, but they actually saw the inverse associated with hospitalizations for children, an actual increase in risk of hospitalization in children. But again, very preliminary data. I think data that needs to be peer reviewed, reviewed by the medical clinical research community to further understand what these findings mean. And again, additional studies are needed to really have a better sense of what the level of severity and these other characteristics associated with the Omicron variant truly are as we get further into studying it. Colorado so far has identified 5 cases of the Omicron variant to date, and we also have now detected the Omicron variant in multiple wastewater systems across the state. And with that, I will turn it over to Dr. Franz.
Thank you. Good afternoon, everyone. This is, of course, the season of our holidays and of our celebrations with friends and family. In general, I would say it feels much safer than it did a year ago at this time, thanks to vaccination, high rates of vaccination within our state. I'd like to start today by just highlighting some things to think through as you're planning holiday get-togethers to be sure that they're safe and limit any spread of COVID. First, consider with your gatherings to ask that those who come together are vaccinated or have been tested in the prior 72 hours. I think this can be both for your holiday parties at home as well as those for work. Requiring testing and or vaccination should be very successful at reducing the chance of spread at your holiday gathering. If, of course, you're feeling ill, as always, we ask that you get tested and that you stay home and that you've had a recent contact with somebody who has COVID-19, that again, you quarantine yourself over that required 10-day period. Consider your party's size. If you can make them to be smaller, or with the nice weather we've been having, have them outdoors. That will improve ventilation and reduce your risk of COVID exposure. It's important to keep a list of the people that you have at your parties so that if indeed there does appear to be a case that was at the party, you're able to do the appropriate outreach so that those persons can quarantine. If you're gathering indoors, think about the opportunities for improving ventilation. We know that ventilation is an important way of reducing risk for COVID exposure. And we have other recommendations that you can find online at our website to see more holiday safety guidance. Next slide, please. This is the season for boosters. The mRNA vaccine is a 3-dose vaccine with boosters, the J&J a 2-dose vaccine. And so please consider this the time of year for everyone to complete their boosters. I'm pleased that of all eligible Coloradans over 16, 46% of them have gotten their booster. We just recently sent out a text to those who are 18 and over to remind them to get their booster if they haven't had it already, based on the information we have in our immunization information system. And of course, we encourage all 16 and 17-year-olds to get boosters as well, since they are now recommended to be boosted as well. We are providing more sites for vaccination, in particular community sites here in the metro area and up and down the Front Range, just to be sure that it's easy for people to get the booster or to get the vaccine if they need to finish it off or begin their vaccination process. So if you go to our website, Vaccine Finder, you'll see a list of a number of different sites that are drive-through, make it simple and quick for you to get your booster shot. Next slide, please.
And with that, I will go ahead and just give a little bit of notice here to some members of the media and to people following along. We do have some planned website maintenance scheduled for Friday, December 17th from 9 p.m. to Saturday, December 18th at 11 p.m. The maintenance may not take that entire time frame, but that's the time frame we have expected right now during this. All state websites, including CDPHE's main site and the COVID-19.colorado.gov site, will be unavailable. Email communications, vaccine scheduling tools, and the Google Forms that healthcare providers use will not be impacted. And we're going to be posting and sending out in a release a PDF file that has really the main resources that folks may need while the website is down. Please note that the comassvax.org scheduling sites will remain functional. People can visit vaccines.gov to help find a vaccine appointment, and they're always welcome to call our call center at 877 COVAX-CO. That alert there at the bottom, you can see that banner that's currently posted to give some advance warning on some of our web pages. And we will be sending out a release with that resource PDF and posting that to our social media channels in the near future in advance of this Friday start to this outage. So from here, I'd like to turn it over to our data manager, Tavio Parocchi from CDPHE, to do a quick demonstration here of some of the new updates to our vaccine data dashboard that will be coming later this afternoon.
Thanks, Brian. Get my screen up for everybody here. Wonderful. So we have 3 data dashboard updates for the vaccine data that's going to go live today at 4 o'clock. If you guys notice the top left, these will be the numbers that you guys will be seeing at 4 o'clock. So a little advanced peek as to what's about to go live for us. The first edition we have is going to be on our homepage. Most recently, we added vaccination rates at a state level for various age breakouts. We're not going to be including a booster and additional dose percentage here. I do want to call out, though, the way that we define some of these terms. They do match with the CDC's data tracker definitions as well. But we are counting people who are fully vaccinated if they received 2 doses on different days, regardless of the time interval of the 2-dose mRNA series, or if they received 1 dose of a single dose vaccine, which at this time is the Johnson & Johnson dose. We also count people who received a booster dose as anybody who is fully vaccinated and has received any other dose of COVID-19 vaccine. This is going to include people who received booster doses and people who received additional doses. Again, this follows the same general framework that the CDC does for their data tracker as well, but it's slightly different than some of the clinical considerations like Dr. France has gone over as well. Last thing I want to call out too is that our denominator for the booster and additional dose percentage is the number of people who are up to date in that age group category, which is going to change daily, which also means that this rate is going to fluctuate daily, and there is the possibility it fluctuates down instead of up daily, depending on what vaccination records we get coming in. So unlike most of the numbers on our website that are strictly increasing, this one can fluctuate downward, but that is to be expected. We should see a general rise upward. Second update that we have for you is in our vaccine administration section. We have broken out administration into 3 different categories now. We have the first category as administration of all doses. This was previously what we just labeled as administration. So if you've been viewing our website before and you're looking for the conventional administration data, it will be the default one displayed for you. You can go ahead and check it out here under administration of all doses. We are breaking this out into primary series and additional and booster dose administration. Again, we're following the same definitions as before as to what an additional or booster dose is. Any dose that was administered after a patient was up to date counts as a booster or additional dose. Any that were included in the 2-dose or 1-dose primary series are going to be in the primary series administration. This all relies on shot record data as well for people, which again is updated daily. So these numbers again may fluctuate. We may see some additional booster doses become primary series doses and vice versa. Finally, we do have for us a addition to our county level data, both in the 1+ vaccination and in the up-to-date vaccination rates. We now have 4 age breakouts. We have the 5+ breakout, which is everybody who's eligible. Our 12+, 18+, and 65+ that we previously displayed remain here as well. Our denominators, just for clarity, are based on the Colorado Department of Local Affairs 2020 population data, and we do exclude Department of Corrections and MAPE populations as provided by DOLA as well. That concludes the 3 updates that I have for our data dashboard that goes live today at 4. I'll turn it back over to Brian. Thank you.
Great, thank you for sharing that, Tavia. We'll have that published at 4 o'clock, and we'll send out some additional information about that between now and then. We're gonna go ahead and move on to the Q&A portion of today's media avail. We'll go ahead and use that raise hand function. If you'd like to ask a question, please click that raise hand, and then we'll go ahead and get to those questions in the order they were received. Let's start with first questions first. If time allows, we'll come back for some second questions or follow-ups. Please state your name and your outlet before asking your question. And if there's any questions we can't get to today, or that maybe were not covered in today's press conference, please feel free to email us at media_info@state.co.us. Let's go ahead and start with Meg Winger.
Hello, this is Meg from the Denver Post. I just wanted to ask, you said about the Omicron being found in multiple wastewater systems, suggesting maybe some community spread. Can you say which systems those were?
Sure, yes. That was, so Boulder, we had previously identified Omicron in wastewater in Boulder, and that was identified again with our most recent sampling. In addition to that, the wastewater system in Aurora, also Commerce City, and then a system that is shared between Lakewood and Denver.
All right, let's go to Jason Grunauer. Go ahead, Jason.
Yeah, if I could follow up on that question. The fact that it's found in multiple wastewater systems, I know it's still early, but is this at all following what we might have seen with Delta early on, or any indications that this could mean that it's going to go large?
Yes, so I would say that we fully expect that we are going to continue to see increasing rates of the Omicron variant here in Colorado. We know that that is already occurring in some states across the US. It's certainly what we're seeing play out in some European countries right now. So we fully expect that we will continue to see an increase in Omicron cases. One of the things that I'm tracking closely as we identify cases through testing and we do contact tracing, looking for evidence that those cases were cases that were acquired either through travel outside of state or even outside of the country, or cases that were acquired here in Colorado. At this point, just one of our 5 cases is a case that appears like it was acquired here in Colorado. And contact tracing related to that case does indicate that there appears to be a linkage to someone who traveled out of state, but again, that's more than one step away from that individual. So at this point, that's really the transition we're looking for, is going from a place where we see sporadic imported cases of the Omicron variant to a place where we see more local transmission. And then of course, we'll be tracking the proportion of those specimens that are being sequenced to look at that transition over time and where we start to see a growing percentage of those specimens sequencing as well.
Go to Vinny. They'll just go ahead, Vinny. Let's see, Vinny. Not quite able to hear you. Are we?
Can you hear me now?
There we go. Go ahead, Vinny.
Okay. I'm sorry, I must have hit the wrong button. Please excuse. This is Vinny Del-Giudice at Bloomberg News in Denver. This is for Mr. Bookman. The hospital beds, the supplemental beds, how many are in service now, and how many do you anticipate you'll be putting in place? And also, do you have the latest hospital census numbers, bed availability, et cetera? Thank you very much.
Thanks, Vinny. The number of hospital beds is always a moving target. We are working with our healthcare systems and our federal partners to continue to bring on additional beds. As we've seen cases go down and hospitalizations go down, we are continuing to monitor the need right now. We've seen relative stability in our hospital beds over the last several weeks. And with that, I mean, even as hospitalizations are going down, we still see about 80 ICU beds available at any given moment, and around 500 medical surgical beds available. And what we know from our hospitals and our health systems is they're working to catch up on procedures that they weren't able to do early on. And so, we are still working with our combined hospital transfer center to ensure that we have capacity statewide.
All right, let's go to Blair Miller.
Hi, this is for Dr. Hurley. I was just kind of wondering, as we're still learning about Omicron in general, and its ability to sort of overtake Delta possibly, how does that work in terms of transmissibility versus severity in, the host versus it overtaking the Delta variant as the dominant strain?
Yes, great question. And I think something we're still really trying to understand. So we have two countries now with pretty different circumstances. So we have South Africa, where the overall transmission level was quite low when Omicron appeared and rapidly spread. We saw those really rapid increases in South Africa. But then we also have the example of the UK, where there were higher rates of transmission occurring, and that was primarily due to Delta. And at the same time, they're now seeing a rapid increase in the proportion of cases there that are Omicron. So it does look like Omicron does have the ability to potentially replace or co-circulate with Delta, but I think there's still a lot to try and understand and what the long-term trends are going to be. With Delta, we saw the earlier variants, earlier lineages of the virus nearly completely replaced, right? But we don't know, are we going to see co-circulation of Omicron and Delta, or are we really going to see Omicron replace Delta? I think those questions.
All right, Michael Day-Ioana, go ahead.
Yeah, Michael Day-Ioana with KUNC Public Radio. And this is a question for Dr. Hurley. I'm wondering what you think of two trends here, because I don't know what to think of them. On one side, there's this increasing positivity rate in some parts of the country, like New York City, where the positivity rate for coronavirus cases doubled just this week, and to 7.8. And I think most of those cases are Delta. And then on the other side, we're looking at what you have said before is a really good barometer for judging coronavirus in Colorado, and that's the hospitalization, the number of hospitalizations, which appears to be, I guess, going down at this point. Certainly not where it was a few weeks back, when it was kind of at that plateau of about 1,500 cases. So I'm wondering what you think of these two trends.
Yes. So I think your question's insightful in that we really look at multiple sources of data to have a full picture of what is happening with COVID-19 transmission. So we know that percent positivity data can be an early indicator for us of where our trends might be going. We often see that value rise, and then our cases rise, then we see our hospitalizations and our death numbers rise. And then the reverse is true as we start to turn a corner and those numbers are coming back down. So, the fact that we are seeing an increasing percent positivity in certain states on the East Coast, but not seeing hospitalizations increasing there yet, makes perfect sense to me, in that we know that data is going to lag. It takes a while for individuals to become ill enough to require hospitalization. And there can also be some greater lags in reporting of that data. So I think at this point here in Colorado, all of our indicators are looking like they're moving in the right direction. We have percent positivity going down, cases going down, hospitalizations and deaths all going down. What I will be looking for in the next couple of weeks is, whether or not we see that percent positivity trend change, and then potentially see that go up, and that our cases would follow after that. So we look at all of them together. Really, some of them are better at showing us early trends. Some of them are less biased, like hospitalization data we know is less biased by holidays and other events when people may choose to get tested less. So they all really play a role in giving us a full picture.
All right, let's go to Chris Vanderveen. Go ahead, Chris.
Chris Vanderveen with 9 News. And I'm joining this late, so if I may be asking a question that's already been asked. I'm really curious about expectations when it comes to Omicron really potentially taking over here in Colorado. Are we talking about sometime in January, where we would expect it to be really rising in numbers based upon what we're seeing in other countries and in other states. And is January really our critical window to understand what's going to happen with Omicron in Colorado and around the country?
So I think lots of questions remain. I think one of the benefits we have with this particular variant, and this is in contrast to Delta. If you remember with Delta, Colorado, specifically Mesa County, saw an early rapid increase in the Delta variant that was unique around the country. At this point, while we've identified some Omicron cases here in the state, and we are seeing probably a gradual increasing in that number of cases, we are not a state right now that is seeing a rapid increasing proportion of our cases that are due to Omicron. And the US is certainly not a country that is seeing a rapid increase right now, at least when compared to other countries in Europe and South Africa, of course. So I think we have time over the next couple of weeks to really try and understand what the timeline might look like here in Colorado and in the US in general for when we could expect to see a rapid increase in cases, and when, how long that increase might last, how high that increase might go, what the hospitalization rate might look like. I think we're really trying to quickly understand all of those potential forecasts for the state based on what we're seeing in other places. So I think at this point, lots of questions remaining, but I certainly, based on what we're seeing elsewhere, do expect that we will, over the next couple of weeks, continue to see an increase in Omicron cases. I think we just don't know how quickly it is.
All right, thank you to Director Bookman, Dr. France, Dr. Herlihy, and Tavia Pierotti for presenting with us today. Thank you all for joining us this afternoon. If you have any questions that we weren't able to get to or that were not covered in today's media avail, please email us at media_info@state.co.us, and we'll get back to you as soon as we can. Enjoy the rest of your afternoon.